Hello and welcome to another exciting episode of Meet the Practitioners on HealthAfrik. This program is brought to you by the Association of African Universities in collaboration with Center for Pregnancy and Childbirth Education, CPACE. And you know this program focuses on educating families and women on issues related to pregnancy, childbirth, and early motherhood. My name is Isabella Teta Hinakwa. We'll go for a quick break. When we come back, I'll introduce the topic for today's episode as well as our beautiful guest for today. Please stay tuned. You're welcome back from the break. This is Meet the Practitioners on HealthAfrik if you just tuned in. And you can follow the discussions on our social media handles at Association of African Universities on Facebook and YouTube. Today we'll be discussing the importance of breastfeeding. And we'll be talking about addressing some of the common myths and concerns. We'll also be providing essential guidelines and advice for mothers, and the goal is to empower women to make informed decisions about breastfeeding, as well as to create a supportive environment for women who have decided to breastfeed their kids. We are privileged to have here with us Dr. Lauren Asamoah, who is a doctor from Rage Hospital. Hello, Doc.
Hi.
You're welcome to Meet the Practitioners.
Thank you so much for having me.
Great. Before we begin today's discussions, I'd like you to briefly tell us more about yourself. Aside being a doctor from Rage Hospital, what are you specialized in? What are you doing? And all that.
So aside from being a medical doctor, I'm also an international board certified lactation consultant, the second currently in Ghana.
Okay.
And I'm also an Australian trained midwife,
Wow.
in addition to doing medicine. So I'm yet to specialize yet. So currently I'm at internal medicine at Rich Hospital.
Wow. You're welcome once again.
Thank you.
Great. So today we are discussing breastfeeding.
Yes.
And you know, when we talk about breastfeeding, all that comes to mind is feeding infants directly from the mother, as the milk produced by the mother. If you can tell us what, aside that, maybe there's an explanation to that, and also the benefits of breastfeeding.
Okay, so as you said, breastfeeding is essentially feeding from the breast, but we do also consider breastfeeding as when women supplement their babies with their breast milk, not necessarily putting them directly to the breast.
Okay.
It is still considered breastfeeding.
Okay.
Now, when we look at the general benefits of breastfeeding, you can look at it as the benefits to the mother and then the benefits to the baby.
Interesting.
For the benefits to the mother, research lets us know that it helps to reduce the risk of developing ovarian cancer, breast cancer.
Okay.
The statistics are there that breastfeeding does help in the long run. Aside from that, too, initially post-birth, it allows and helps your uterus to shrink down with the release of oxytocin, which is why some women, when they're breastfeeding, they may say that they're having some abdominal cramps.
Okay.
It's just as a result of the hormones that are released when you're breastfeeding. And then aside from that, just the general bonding that women get with their babies.
Yeah.
For babies, the general benefits are quite a lot. In the initial phase of being delivered, we know that it helps to regulate their breathing, their heart rate, and even their temperatures. And one of the wonderful things about regulating babies' temperatures is it reduces the risk of their blood sugars coming down and then needing subsequent intervention and needing to be given formula and other things. Aside from that, long term, we know that babies that have been breastfed have a reduced risk of developing cardiovascular diseases and even things like diabetes and obesity. And aside from that, some cancers as well. We've seen that there's a reduction in the risk for babies that have been breastfed.
Interesting. All this while I thought breastfeeding only benefits kids. I didn't know, or infants. I didn't know the mothers also benefit from that. That is quite educative. Now, we know that as part of the importance or benefits of breastfeeding, it boosts the immune system of the infants. Now, how does this help? How does this actually happen?
Okay, so I think the easiest way to liken it is almost like when you go for immunization, when like how COVID came out and we're all asked to immunize.
Yeah,
the whole point of vaccinating is it's kind of allowing your body to be exposed to whatever that virus or infection is before you encounter it, so that when you do encounter it, your body responds in a better way.
Okay.
Breastfeeding can be likened to that as well. The beautiful thing is, as a mother, you've likely been exposed to a lot of viruses, infections, and also received some vaccinations in your lifetime. And through breastfeeding, those antibodies and things that you've developed are passed through, and baby also gets them. So now baby is not as at risk of developing some of these infections. Aside from that, when you're breastfeeding, one of the wonderful things that it helps is to reduce the incidence of diarrheal diseases. So babies passing a lot of loose stool, vomiting, and those things. We find that there's an increased incidence for those who give formula simply because of the hygiene involved. You have to make sure you're getting clean water. You need to be sterilizing your bottles. You don't encounter those difficulties when you're breastfeeding, and that's one of the reasons why we tend to say that it helps to build the child and cover them when they're immunity.
Interesting. In your submissions, when you were mentioning some of the benefits of breastfeeding for infants, you made mention it regulates their temperature, also reduces the blood sugar and other things.
Not necessarily reduces, but maintains.
Okay, it maintains it. Okay, so now let's look at the nutritional aspects of breast milk.
Yes.
What are some of the nutrients in it, and how does this actually benefit the infants?
So when we look at the composition of breast milk, it has your fats, your proteins, and your vitamins. The wonderful thing about the human body is the fats that are produced through breast milk have been found to really aid in brain function and development in babies, which is why you find us really pushing that breastfeed, because we know that it lays down these initial foundations that your child is going to need later in life. The proteins as well are going to help your baby in regards to energy. And then the vitamins, particularly vitamin A and E, are known to help with vision. So those, just to touch on it, those are the key components that we like to look at when it comes to breast milk.
Okay. Also, you made mention as you are breastfeeding, it's a form of bonding with your child. How is that possible? Is it, I don't know, what's the connection between the mother and, because I know you've already bonded when you were in the womb. So how does breastfeeding also introduce bonding between the two of them?
So the wonderful thing is it ties everything together. In the womb, your baby's moving, your baby's kicking, but you don't actually get to see all that happening. Once you have your baby and you're breastfeeding, you bring your baby very close to you. You find that there's some skin to skin happening. You can see your baby. You're now having baby touching, exploring, and all those things build a bond. And the hormones that are released during this period as well help to build a bond. You also kind of start to pick up your baby's mannerisms, how your baby cries, hearing that cry. And now you'll even find that there are some women that they'll hear the baby cry and they just let down milk. It's all a part of that bonding process.
Wow. So, you know, growing up, I saw my mom, and use my mom as an example, before childbirth, and there's this preparation you have to go through so that when you give birth you can produce enough breast milk for you. Some are taking soup, the corn, fermented corn porridge, among other things. Being an expert, what would be your advice to women preparing for childbirth? What would be some of the nutritional guidelines for them, aside the nutritional medications and all that? What should be the preparation before childbirth to be able to produce healthy and enough breast milk for your child?
So I love that you started by saying what are the things that you should do before you deliver. And that's really key because most of the preparation actually starts before baby comes. And that's in the way of even your breast changes. Early in pregnancy, it's important to note, are your breasts changing? Are they getting bigger? If you're not seeing those signs, then it's important to involve someone early because those changes are a marker that, okay, your body's starting to build the process that's going to allow you to breastfeed. When we look at nutrition in particular though, nutrition before you deliver is the most important. You'll even find that for babies that are in areas where maybe there's outbreaks of war and things, when they're born, they're actually still nutritionally stable for that initial period where they're breastfeeding, even though you may see their mothers and they're quite malnourished. It's because the body has been able to kind of produce these stores, and that's what it relies on when baby comes. So the main thing is maintaining a very balanced diet. It's not necessarily needed to go out of your way to go for special foods that we traditionally look for. Yes, of course, there are some things that you can consume that we know increases milk production, but they're not necessarily things that you have to do to say that if I don't do them, I won't get the breast milk for my baby. But yes, preconception care is also very, very important. And especially for women who found it initially quite difficult to get pregnant, it's key to put in the back of your mind that those are the same hormones that act on breastfeeding. So if you were having that difficulty, you should also start that conversation early so that you can still have that wonderful breastfeeding experience that you'd like to have.
And aside that, are there any medicational process you have to go through in order to produce enough breast milk for your kids?
Not necessarily
so it
at
happens
all.
naturally.
So just to give you a bit of an idea regarding how breast milk is produced, is it's kind of a supply and demand situation. When baby comes initially, we tend to recommend that within the first hour, you're putting baby to the breast and allowing baby to breastfeed. And that's going to help set you up for a better outcome. The way the body is if baby's not sucking or your body doesn't feel like there's a baby there to feed, then you'll find that over time, your supply will go down. You'll find a lot of women saying that, I don't have any milk, I don't have any milk. The funny thing is you've actually had milk on your breast from about 16 weeks of gestation. It's all there, the foundations are there, which is why from about 37 weeks, we can even tell some women once they're term that they can start expressing some of that breast milk and putting it aside, especially for women who might be at risk of developing preeclampsia or they even have gestational diabetes where their babies tend to really need that milk in those first few hours. We do tend to recommend that they can start expressing around that 37 week. And so that's just kind of stimulating your breast, trying to apply pressure near, like not at the nipple, but a bit beyond around the areola area, and then collecting that into syringes and keeping it aside. You can store it in the fridge or even in the freezer, labeling that, and then giving it to baby within that initial, within that initial period, whilst you're also adjusting postpartum.
Thank you for stressing on the fact, first of all, stressing on the fact that you don't need to go out of your way to be able to produce that. It's just keeping a balanced diet and also preserving the method of preserving breast milk. I was about asking that. Now let's look at the duration for breastfeeding. You know, currently women are trying to be career women. We are trying to show that we are also independent. We can take care of families at the same time, do our personal jobs and all that. Hence, it leads to women not following the right duration for breastfeeding. They give the breast milk for a period of time and then they cut it and start giving solid foods and other things to the baby. What is the recommended duration for breastfeeding?
The recommendation.
And how important is that duration?
Okay. So the recommendation is 6 months. That's what WHO currently recommends. Exclusively breastfeeding for 6 months. But we do also understand that in this current life that we live in, women having to go to work, it can be difficult. So we will always say that any breast milk is better than none. So trying your best as much as possible, especially if you're a career woman, you can say that, okay, I may not be able to breastfeed my baby during the day, but making it a point that before you leave for work, you breastfeed. And then as soon as you come back to, you breastfeed baby. If you have the appropriate supports in place, you can actually be expressing at work and allowing someone to come and pick it up and take it to baby during the day. The reason why we tend to recommend the 6 months is we know that within the 6 months, breastfeeding and breast milk is able to adequately meet baby's nutritional needs and give them the appropriate foundations they need for later life. So that's the main reason why that's the recommendation, and not introducing other foods, because usually the infant's gut is also quite immature. So when you start introducing these foods, you do tend to place babies at risk for other things later in life.
Very true, very true. Now, so aside the career aspect, which is not an excuse, there may be a circumstance where a mother will not be permitted or it is not advisable to breastfeed. Well, what are some of these circumstances, and also what are the alternative methods aside the natural way of breast milk breastfeeding? What are the alternative ways a mother can at least feed the infant to be able to meet the nutritional needs, as you made mention?
Okay, so in regards to times where we say don't breastfeed your baby, it'll be for women with HIV who are not receiving treatment. I emphasize again, who are not receiving treatment, because if you're receiving treatment, you can actually breastfeed your baby. And you have to exclusively breastfeed, not that you're giving mixed feeds. If you're giving mixed feeds, then you're not doing it in the right way and you're putting your baby at risk. And it should always be done with a health practitioner. Aside from that too, babies whose mothers have active TB, ideally it's not safe for them to be feeding, so they need to be treated first. Then for infants that have galactosemia, so the issue with galactosemia is babies are not able to metabolize that galactose. So they tend to develop liver problems and it becomes issues subsequently. So they require supplementation, and we will unfortunately require women to stop breastfeeding their babies. For women who are on illicit drugs, it's not safe for baby because they can pass through the breast milk. Or also advised not to breastfeed. And then in some cases, women that have very severe depressive conditions whereby the breastfeeding itself is acting as a precipitant or a trigger to that stress. In some cases, we may also say not to necessarily breastfeed. Then for women who are also receiving chemotherapy, it can be quite dangerous to babies. So during that period where they are receiving those cytotoxic agents, we would usually say that kindly hold on with breastfeeding and supplement baby at this time. But again, everything should be done with a clinician and not just on your own.
Right. Now, before we go for break, you made mention of mixed feeding. If you can explain that to us.
So when we talk about mixed feeding, it means giving breast milk and also supplementing with formula. That's what we refer to when we talk about mixed feeding.
Right. Thank you very much, Dr. Lauren. We'll go for a quick break. When we come back, we'll continue with the discussion.
Thank you.
Please stay tuned. We'll be right back.
Are you a researcher or an innovator making a difference in Africa and Europe? The SIA Project invites you to share your success story and join a movement dedicated to sharing best practices, bridging knowledge gaps, inspiring others, fostering collaboration. Share your story now and be recognized, celebrated, connected with global network of researchers and innovators. For more information and to submit your story,
Hello Africa is a live breakfast show that aims to give you, our viewers, an informative, entertaining, and energizing start to your day. This isn't just another news show. It takes the form of vibrant magazine packed with news reviews, lifestyle features, engaging interviews, and interactive segments that put you at the center of the action.
All you have to do is grab your coffee, get comfortable, and join us for the Hello Africa morning show.
We are here to kickstart your day with the news and stories that matter to you, alongside all the fun and inspiration we crave.
Every morning, join us for
the latest headlines in African higher education, science, and
quick and informative newspaper and online news review.
Lifestyle tips on fitness, nutrition, fashion, and beauty.
Inspiring interviews with influential figures and everyday heroes.
Performances and interactive contests, and so much more.
In Ethiopia, Salam Africa. In North Africa, Alan Afrikia.
In Swahili, Jambo Afrika. Tune in every Monday from 8 a.m. to 10 o'clock GMT. Join us to make it a fantastic day together.
Hello Africa, your daily connection to the continent. You're welcome back from the break. This is Meet the Practitioners on HealthAfrik, and if you just joined, you can follow the discussions on our social media handles at Association of African Universities. Before the break, we discussed what breastfeeding is and also the nutritional needs for the benefits for infants, and also how a mother can prepare for before childbirth. And we are privileged to have here with us Dr. Lauren Asamoah from Ridge Hospital. Hello, Doc.
Hi.
Thank you for sticking with us.
That's fine.
Now, so let's continue with the preparation before the baby arrives. I know we've delved on that, but probably there's more information you want to give us. What should a mother do before a baby arrives? Let's look at the hygienic aspects. Also, if there is any more information on the nutritional aspects, as well as any other things.
Okay, so For hygiene-wise, bathing is fine, but for some women who also find that they leak when their milk is coming, they should always try and keep a cloth nearby to keep the area dry.
Okay.
In regards to the preparation, the good thing is that we have family units. As a woman, it's important to remember that you're not alone. So it's good to really get your mother involved, get your partner involved, and let them be part of your tribe. And so that means knowing also what you want from the get-go. If you have intended that you will breastfeed, regardless of what happens, it can happen. And that means informing your partner of your wishes to breastfeed. So if that means when you're exhausted postpartum, they're going to be there to help put baby skin to skin. There's something that we call the breast crawl that babies often do in that first period, that within that first hour. When you put babies to skin, they can actually make their way to the breast by themselves and start feeding. So if you find that I'm so exhausted, how am I going to now put baby there? Your baby can actually do that themselves with the support of your partner or your mother or whoever you have around during that time. Also letting the staff involved with the delivery also know that these are your intentions really helps you during this period. So the one big thing that I'll say is communicate your wishes and let it come to pass.
Communicate your wishes. Very true. And also, before we went for break, you made mention, or you made us know the recommended duration for breastfeeding, which is 6 months. Now let's look at the frequency of breastfeeding. You know, when women are busy, they will prefer to do 3 times a day. That's breakfast, lunch, and then supper. What is the right frequency to breastfeed your infants?
So we usually say about 3 to 4 hourly. You should be offering baby the breast, even if baby isn't waking up. You should really try and you should wake baby and put baby to the breast. For babies that are preterm, we may even go as short as 2 hourly. But you'll find that in the initial period, not the first or second day, maybe by the 3rd day, getting to that 72 hours, in the evening, your baby will just want to feed. And for many women at that point in time, it's easy to say, I don't have enough milk. I've fed baby, I've put baby down. Why is it that baby wants to feed again? Baby's actually doing what is required to get you maximum amounts of milk. As I mentioned earlier, your breast milk supply is based on baby's demand. So by baby demanding more and more milk in that period, your body comes to say, okay, I'm going to need more milk long term. So let me start making more. So when baby starts doing that, I know you'll be very exhausted. It'll be very tempting to throw in the towel and just say, let me take baby off and give baby formula or supplementation. Try as much as possible to hang in and just keep giving baby the breast. In the long run, it'll do yourself a favor and your milk will come in. Baby will be very satisfied and you will be okay. But yes, for the frequency, we usually say about 3 or 4 hourly. So it helps to work as a team. I know saying that it does sound a bit daunting, like, oh my goodness, I'm not going to have time for myself. How on earth am I going to be able to feed this baby 3 or 4 hourly? In the first few days, the truth of the matter is it's quite demanding on a mother. But as things go along, one thing that it's good to know is you don't actually necessarily need to be fully awake during the feed. It's just important that at least one adult around is awake during that feed. So if it means that maybe you wake up at the first 3 hours, then at the following one, your partner wakes you. You're not able to wake fully, but he helps you put baby to the breast. And then he watches over the two of you to make sure that you're safe, baby's safe, and is able to breathe throughout that feed. Then you can do that. But it's just about communicating with each other and making things happen.
This actually stresses on the fact that the husband is very, very needed when it comes to breastfeeding. Now, let's look at some of the common myths and also misconceptions with breastfeeding. One, the common one I do hear is related to the pains women feel around the breast. So they expresses that when the baby burps or they feel air enters into the breast, leading to maybe the milk spoiling, where that's why they feel pains and all that. What are some of the can you first of all explain the facts? Let us know the facts behind the pains, and also you can see some dots on the breast. So what was the facts behind that, and also some of the myths you've encountered with your patients and all?
So let me start with the dots on the breast. I'm hoping you mean around the areola region.
Yes, Ali.
So what we refer those is they're called Montgomery's glands.
Okay.
And what they do is they kind of secrete something that's supposed to help with the general lubrication around the nipple, and also the sense of it also helps baby locate the breast when they're doing that initial breast call.
Okay.
Now, in regards to this burping that happens and then subsequently women feel pain, the likely mechanism of that is baby may come off the breast a little bit at that time, which means now attachment is a bit poor, and now women start to feel that pain and pinching. One thing I'd like to take the opportunity to reiterate is breastfeeding should not be painful. You may feel a little bit of discomfort, but it should not be pain. If at any point you start feeling pain, as a mother, don't feel guilty. I know often in our setting, we may find that, no. If you do that, you'll find that you're setting yourself up for a very terrible breastfeeding experience. And that initial pain will now turn into an ulcer and bleeding and damaged breasts, which can then lead to infection, because now you have an impaired area where bacteria can enter. So please, 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 if you start feeling that pain, take baby off safely. You can do that with clean hands. Put your finger in the corner of baby's mouth. Break that suction, because their suction is very strong. So break that suction, take baby off, and then put baby back onto the breast. The main thing is making sure that baby is deep onto the breast and not just on the nipple. If you look at the baby's mouth, the front part is quite rough and the back is very soft and cushioned. And that's where the nipple's supposed to sit. So if you're not putting baby on well and baby's just at this rough part, you'll feel this pinching and this pain and this rubbing, and that's what's going to cause you the pain. But when you're making sure baby opens very wide and the nipple goes right to the back, then that's now where you're going to find a very lovely breastfeeding experience.
Now, aside that, are there any other myths you've encountered or do hear?
Yes,
around?
I think I've heard some people say that one breast is for water, the other breast is for milk. It's not true. They both produce milk. And the wonderful thing about breast milk is it's actually able to cater to baby's needs. When it's very hot, you'll find that the composition of water is higher in breast milk, so babies don't get dehydrated. When it's even very hot, the temperature in breast milk can actually drop a little bit, so it's a bit cooling to baby. I've also heard sometimes that some people say that when you've not breastfed for a long time, the breast milk in your breast spoils. That is not true. You can still breastfeed baby that milk that's in your breast. You'll find you'll even feel very comfortable after doing so. It's not spoiled. Some people may also say that freezing your breast milk and giving it to baby is not safe. Also not true. Breast milk can actually be kept safely in freezers. Depending on the kind of freezer you have, can stay there for about 3 to 6 months. Yes, depending on the kind of freezer that you have, it can stay in there for quite a long time.
And it's still safe.
And it's still safe. Some women too may see when you put the breast milk down, it separates and they think it's spoiled. We all know that oil floats. So that separation is just the fat rising to the top of the milk. You can just shake it, mix it, and it'll just be fine for consumption.
If I should see that, I'll get scared. I'll think, what is happening to me?
And it's normal because you don't know what it is. You're just like, when I brought this thing down, it was a nice creamy color. And now
all of a sudden it's separated.
You think that, my milk was spoiled. No, it's not spoiled at all.
And another myth or misconception I do hear is breastfeeding or breastfeeding or breast milk actually causes breast cancer, especially when they believe that it is spoiled in the milk. Is that true?
So funnily enough, it's the inverse in that breastfeeding is actually protective. So women who breastfeed are actually at a reduced risk of developing breast cancer.
Wow, you heard that. As you breastfeed, you are reducing the risk of getting breast cancer. Now, let's look at some of the challenges new mothers face when they start to breastfeed and how they can overcome them. Like you made mention, 3 to 4 hours.
It's a lot.
It's a lot.
Yes.
And even the posture, how you have to sit to breastfeed. Like it's too much. It's too much.
I understand.
So what are some of the challenges, and also how can we overcome them?
Yes. So when you're breastfeeding, it's okay to be a little bit selfish in that as a mother, you have to take care of yourself. One thing I always tell my clients is, if you're not looking after yourself, there's no way that you can appropriately look after this baby. So yes, when you're breastfeeding, it's good to support yourself. Find a comfortable chair. If it means supporting yourself with pillows, then do so. Aside from that too, again, the pain, if you start feeling pain or your nipples become damaged, don't be so German and say, I can do it. No, it's okay to rest your breast. It's okay to say, okay, I'm only going to feed baby from one breast, and then the other side, I'll empty express and then give that to baby as a top up with a bottle. It doesn't spoil anything. Like I said, breast milk is best. As long as you're able to get that breast milk to baby, no matter how you're getting it out, doesn't mean you failed. And unfortunately, in today's age, social media has kind of given us a bit of a skewed picture of breastfeeding. The things we tend to see are women with heaps of milk, and then you also look at your breast and you're like, oh, what about me? But we don't see the closed door aspects that in that first few days, they weren't seeing much milk. It takes a while for your milk to come in. On the first day, you're not going to see huge amounts of milk. And it's good to know that your baby's stomach is actually about the size of a marble on that first day. They actually can't take that much milk. Aside from that, when they come out, because they've been swallowing all this amniotic fluid and things, they tend to have, and they have brown fat, they have stores that kind of keep them okay for up to about 72 hours. So the main thing for hospitals and things is just monitoring baby's blood sugar and making sure that it's not dropping. If baby's blood sugar is okay, you can take your time, but as much as possible, breastfeeding within that first hour, and then continuing that continued breast milk and breastfeeding, and also feeding in the night. I know sometimes it's easy to say, I'm tired, I'm not going to breastfeed at night. I would rather breastfeed in the night and rest a bit more during the day, because the cells that help you to make more breast milk are more active at night. So if you forego breastfeeding in the night, you're actually reducing your production. So that's why babies tend to also be more active at night, because they know that that's when I'm going to be making more milk for myself in the long run.
Interesting. Okay. Also, let's look at breastfeeding in public. Obviously, there'll be a day you'll be out, and then you'll have to breastfeed you. And women do find that very uncomfortable, especially when this is a private part and they have to bring it out for people. What are the best tips to breastfeed an infant in public?
So I think for starters, getting comfortable clothing that doesn't require you to remove your whole bra. There are bras that are made for breastfeeding such that you can just unclip the front and your breast is exposed, so you don't now have to have someone come and remove the back of your clasp and things like that. And also getting clothing that's quite loose in the front, so it's not now someone has to come and unzip your dress before you can breastfeed. And then also identifying areas where you can also go. I know some churches now have mothers' rooms and things. Some areas also have that available to you where you can go and breastfeed. And then there's also some mothers who can just use a very light cloth to cover themselves and cover baby. I say again, light cloth. You don't want baby to become hot, suffocate under there. So something very light. And then also just repositioning yourself. But it's good to know that breastfeeding is very natural. It doesn't need to be something that you necessarily need to shy away or hide. You'll find that by breastfeeding, you also empower other women who are maybe not sure and are still trying to figure out how to breastfeed. Unfortunately for us in this generation growing up now, I'm sure children right now don't really get to see breastfeeding or how it's done. Our mothers, when they were younger, had their mothers also always breastfeeding in the open. You'll see them carrying around a small child, trying like a toy child, trying to position and things. So by the time they have a baby of their own, they have an understanding of how to do it. Unfortunately for us, because women were so scared and society has sexualized the breast, we tend to want to hide it away. So hopefully in future that can kind of change and women can also pass it on to their children.
Very, very true. Now, let's also look at the support from family members and husbands. How can they also, because I know this is not a one-man job.
At all.
You need the support of your family and your husband. How can they support? In what ways can they help to at least release the stress from their mother?
So I think initially I mentioned skin to skin. it's not exclusive to the mother. Fathers can do skin to skin with their babies, which will again help them in regulating their temperature and their breathing and things. And then also just communicating with the mother. And breastfeeding can be quite overwhelming. So taking away other things that may overwhelm her can really help. We have a tendency in our culture that when someone gives birth, everyone wants to rush to their home and see the baby. But by the time you're coming now, the woman feels like, I have to cook, I have to clean, I have to do all those things.
Yeah.
But so changing that mentality that when I'm coming, asking her, how can I help? Is there something I can do? Is there something you've been meaning to clean or wash that I can do to kind of take your mind off this so you can focus on baby in this period of time really helps. Bringing food over so she doesn't now have to cook and things is really helpful. Fathers often get overwhelmed. Unfortunately, we're not in a part of the world where people get very extensive paternal and maternity leave. They have very short periods of time. So during that time, really maximizing and decluttering all those other things that may otherwise stress them is really of benefit during this time to the couple.
And also words of encouragement.
Yes.
When you see there's this, is it postpartum or like where some depression women go through, at least you should be there encouraging her. You can, not you, we can do it together.
And as you've mentioned postpartum depression, I even want to touch on it. I'm quite excited. So initially after you give birth, it's normal to feel a bit down in the first few days. We call what we call the postpartum blues. As your hormones drop and things, you do tend to feel a bit off and tired and a bit sad, and maybe you might find yourself spontaneously crying. It's okay. But if this is now persisting weeks to months, that's when you should be really concerned. And it's really key for partners to take notice of this. You know who your wife is, you know how she is. So you should be able to notice that, no, this isn't normal. We need to get help. And it's a priority to get help, because if she's not well, she can't take care of that baby, and baby won't thrive. It's okay to seek help. It's something that happens, and it really is necessary, because there are some women who tip from depression to psychosis, and they now start hallucinating, seeing things. So it's important to get on top of it as soon as possible. Speak to your provider and let her get the necessary help. Don't let her feel as though other women have had babies and they're fine. Why is it that you're the only person who's struggling? Everyone has how they cope to stress, and everyone has how their body responds. It doesn't mean that you failed as a mother. It just means you need a little bit of extra help, and then you'll be able to get back on track. There's so many women who had postpartum depression, and then with the appropriate support have been able to go on to be fine, look after their babies. But it does really come to having a wonderful support system that can help you through that.
Very true. And also looking at how stressful it is to breastfeed, like you made mention, some churches do have this building, at least just to support women. Are you aware of any resources available to support women in terms of even the location, in terms of capital, like any other support or resources available for
as I mentioned, one of 2 lactation consultants currently in Ghana. We do provide private services where if you do require a consult, you can contact, we'll come into your home for about 40 minutes to an hour, help you with breastfeeding, address any concerns that you have. Maybe you're having issues with putting baby to the breast, or you're having some pain, we can come in, help you with repositioning baby. We can even come in before you deliver, helping you, educating you, helping you draw out a breastfeeding plan. I'm affiliated with Leaf Ghana, who also do some online consultations for women who just want to reach out, get some resources and things. So yeah, there are resources available in Ghana.
So how does someone interested like get in touch with you, or some of these get these
so you can contact Leaf Ghana. Leaf as in L-E-A-F. You can just Google them online. I'm also affiliated with an Instagram platform, Pregnancy Matters Ghana, with my colleague. She's currently not around, so I'm the one mainly managing that. So you can also reach out to me there via our DMs, and I can get in touch that way as well.
That's great news to hear. Now, we are almost ending the discussions for today. But before that, I would like you to, what will be your final message to our viewers, especially those who are hesitant and also not so sure about breastfeeding, and they are scared, nervous to even start the process of getting pregnant, which will lead to breastfeeding? What will be your final message to these beautiful young ladies?
What I would say is you're completely capable. If you've been able to carry a baby, even get pregnant is a miracle. So breastfeeding is not what's going to stump you. Just believe in yourself and trust that you can do it, and you will prevail. And if you do need support, support is available. Doesn't mean you've failed, just means you need a little bit more assistance, and it's okay to ask for help. We're there for you.
Thank you very much, Dr. Lauren Asamoah. Thank you so much for sharing your insights and educating us, especially me. I'm already gingered to get pregnant. Yes, I'm eager to get pregnant. Thank you so much. And we are hoping to engage you again on another topic.
Wonderful.
Great.
Thank you for having me.
Great. That is all for today's discussion, where we discuss the importance of breastfeeding with Dr. Lauren Asamoah from Ridge Hospital. If you just joined, it's not too late. You can visit our social media handles at Association of African Universities on Facebook and YouTube to watch the full discussion, and also take your keynote from that. Mine is breastfeeding is not a failure. My name is Isabella Teta Hinakwa. See you again in another episode. Bye-bye.